If you have a problem with your thyroid gland, your doctor may recommend a thyroidectomy. The thyroid gland is located in your neck, in front of your windpipe, between your voice box and the top of your breastbone. The function of this gland is to secrete hormones that regulate your body's metabolism. If you have low levels of thyroid hormones, you might feel fatigued or cold or may gain weight. Some important structures lie very close to your thyroid gland. The parathyroid glands are 4 little glands behind your thyroid. They secrete a hormone that regulates your blood calcium levels. The superior laryngeal nerves and recurrent laryngeal nerves supply the muscles of your voice box or larynx, the structures needed to produce voice. Your surgeon may recommend removing part or all of the thyroid gland for several reasons, including confirmed thyroid cancer, a nodule suspicious for thyroid cancer, as a treatment option for an overactive thyroid, or to treat an enlarged thyroid gland called a goiter. A goiter can occasionally compress surrounding structures, including your windpipe and swallowing tube. To remove the thyroid, a small incision is made in the neck in a natural skin crease. The surgeon may remove half of the thyroid or all of it, depending on the reason for your surgery. Your surgeon may choose to place a temporary drain in your neck during the surgery. This drain is often removed in the first or second day following surgery. Complications are rare, but the removal of your thyroid gland does carry some risks. 3 of these risks are nerve injury, low calcium, and bleeding. During surgery, the surgeon is very careful to protect the recurrent and superior laryngeal nerves. If the external branch of the superior laryngeal nerve is injured, you may notice difficulty controlling the pitch of your voice, especially in the higher range. If a recurrent laryngeal nerve is injured, your voice could become weak and breathy. This complication can be either temporary or permanent. Injury to both recurrent laryngeal nerves is a very rare complication. Sometimes the parathyroid glands do not function normally after surgery, and your calcium levels may drop. You may need to take calcium pills with or without vitamin D. This is usually temporary until the glands recover, but occasionally may be permanent. If your calcium drops very low, intravenous calcium may be required. This can sometimes delay your discharge from hospital while your surgical team stabilizes your calcium levels. If you experience symptoms of tingling or numbness in your hands, feet, or face, this could be a sign of low calcium. If this occurs, notify your healthcare team immediately or go to the emergency room if you are already back home. Any surgery carries a risk of bleeding. If this happens after your thyroid has been removed, you could notice increasing swelling in your neck. Other symptoms include increased bleeding around your incision, difficulty breathing or swallowing, and increased pressure in your neck. A neck hematoma happens only in about 1% of cases, usually within the first 24 hours. If you do notice increasing neck swelling following your surgery, especially if it is rapid swelling, you should come back to the emergency department immediately. You may need a small surgery to drain the accumulated blood. For more information on how to prepare for the surgery and the recovery process after the surgery, visit the other sections of our website.